One of the things that I have found, and people are already pretty unaware of it, is there's actually quite a lot of oral pain that dogs have, which they don't, or cats have, which they don't often display. You've got to remember they are animals and their instinctive behavior is not to show any vulnerability. So one of the last things they're going to do is not be able to eat and or show signs of weakness. And that includes in a domestic situation as well. Their outlook is very different to ours. They don't always have these emotional hangovers that we do. So their outlook is to be happy all the time, wag their tails when they see you, and interact very well with you. And when they're showing symptoms of oral pain and they'll stop eating, or they're drooling from their mouths, or you find that they can only eat wet food, they're not dry food, they're at a pretty advanced stage already. So they are, in my opinion, they are notorious for hiding pain. So when they don't have dentistry done, that pain gradually sets in, and it takes, sometimes some cats or dogs will take years for that to occur, or before they show any signs of pain. But when they get to that advanced disease that they need a dentistry almost on an urgent basis, the amount of pathology in the mouth requires so much work that it's sometimes difficult to salvage some of those teeth. And we go in there and we're busy cleaning the teeth, and some of them are hanging loose in the mouth, and there's pussy discharge coming from the gums, extremely painful. And even under anesthetic, sometimes you will feel, or when you're busy doing the probing and the examination, even under a stage 2 anesthetic, their heart rate suddenly elevate because they are feeling something. So just because they don't speak, and just because their mouth may smell yucky sometimes, but they're still happy, it's not in your face, and it's not in people's awareness always that they realize that their mouth is sometimes the primary concern. Other than just the local effects in the mouth, the sore gums, the swollen gums, the loose teeth, the discharge from the gums, they often allow the bacteria to spill over in the blood. Gums may bleed. The mouth is like a festering pot of bacteria. It spills over into the blood, and then it moves into the system by way of the blood system or the cardiovascular system, and it will stick on the heart valves. It will tend to be filtered via the liver and tend to be filtered via the kidneys. Those are the 3 main organs, and we very often find infections that develop in the heart valves, the kidneys, and the liver. And it takes time, and it's not something that you see immediately. And again, as they get older, these organs degenerate. When they get older, they're more susceptible to infections, and when we need the severe dentistry care, or the severe oral care, sometimes those organs are not functioning the way that we need to get them through a safe anesthetic. And oftentimes when they are older and you neglect their teeth and you're not doing routine dentistry, the need for oral surgery to have them extracted or to do advanced dental care is much greater. And then people are more reluctant because now they're older. How long can they survive an anesthetic? And they don't want to go through the extent and the expense sometimes of doing oral surgery. So it's a lose-lose situation ultimately. It's a much bigger win-win situation if we're able to do a routine dentistry every year, trying to do some home oral care, whether it be special diets, special gels or toothpaste and brushing, and trying to get them involved as best as possible. Too many times we have people that have said, oh, they get their brush teeth every time they go to the groomer. And the groomer can do, but you've got to still try and remember, it's like us brushing our teeth once every 6 months and saying, oh, we should be okay, but it really isn't.